Guys, we are back here at Atlantic Health, home of Atlantic Sports Health. I am with Dr. Jason Smith. We're talking about back hygiene. We're talking about low back, lumbar, disc bulge, and herniations, and really doing talking about a lot of interesting things. Dr. Smith, I know your practice, you see a lot of low back patients.
Yes.
And a big part of the challenge we have in the low back is just poor spine hygiene, poor sitting, poor bending. What advice can you give to our athletes, our coaches, our parents about proper spine hygiene? What can they do? Even sleeping. I mean, what are the key elements around that?
All right. So some of the key elements, first and foremost, it starts when you first wake up in the morning. Sometimes I tell my patients when you get up, stretch. Just do a simple hamstring stretch. Bend over for a couple of seconds, stretch those hamstrings out. Really kind of allow them to just loosen up a little bit so that they're not consistently putting a lot of pressure and tension on your lower back. Mm-hmm. As your day progresses, obviously good posture is highly important. The motion of your body, like if you consistently have a repetitive motion on your job, if you're an athlete doing consistent repetitive motion, you want to make sure you take time to give your body a break.
Yeah.
Okay. I tell people don't do an activity for longer than an hour at a time if you can straight. Give it a break, whether it's doing sports, whether it's driving a car, you name it, you want to give your body a breather. As far as lifting and bending things, obviously we've heard the old adage, lift with your knees, not with your back.
Right.
That's very true.
Yeah.
Lift with your knees, not with your back. So that's proper. And sometimes that just takes a little extra motivation from ourselves, because I know you drop something, you quickly think, oh, I'm going to go over, pick it up, and before you know it, you've moved in the wrong direction. So it's important to think about. Being in the job, being at the in the school, in the workplace, proper posture, making sure your desk is not too high or too low, making sure that your seat is not too high or too low.
Yes.
Your keyboard, your mouse, whatever have you. That's highly important to help keep that force through the spine as even as possible. Mm-hmm. And you take it even to laying down, laying in your bed. If you want to lay on your back, sometimes it's advised to put a pillow underneath the knees. We want to keep that spine straight. So, you have to have a pillow that supports your neck enough. You don't want something that's going to have your neck leaning back.
Right.
But keeping that spine straight by putting pillows underneath your knees, or if you want to sleep on your side, just put a pillow between your knees.
Yeah.
Basically helps keep that spine nice and straight. And over time, this will become more and more, secondhand nature, to you.
Sure.
And, it really helps.
That's great. I mean, great information. I think I just want to reiterate some key points that Dr. Smith shared. When you're bending, you're bending at the knees, not at the spine. Really specifically, knee bending and hip bending. Rotating at the hip. Again, talking about when you're sitting, I think it's so important you have to, really work on pulling that back up and sitting up straight. I mean, basic common sense, but what I found, common sense isn't too common. So sometimes you need to watch some videos, get fired up, because you will slowly degenerate that disc. You will slowly, that tire around your annulus fibrosis, that disc between those two vertebrae, which we call the blocks, the bricks, right? Your vertebrae are bricks, and you have this tire system that is the annulus fibrosis, that is this vertebral disc. Inside is the nucleus pulposus, the jelly, kind of like a jelly donut. And over time, if you have poor posture, this is going to bulge out or leak out. But we have to preserve our tires, preserve our discs with good back hygiene. And I talk a lot about, debiting your back account.
Correct.
Like you have a bank account, well, you have a back account. You have these tires that you just can't just change in your back. You have to preserve them and not debit. And you debit when you have poor posture, you lift incorrectly. If you're out of neutral, right? You might be squatting and you're in the weight room. Doing things wrong is gonna debit that back account. It's gonna take that wear and tear from those discs and really challenge you. So thanks so much, Dr. Smith. It's been some great analogies we've had here. Look forward to spending more time with you and learning more. Guys, take advantage of this information. This is really important. You've got to be self-motivated to do the things every day to keep your back healthy, keep yourself healthy. And when you do that, you're going to burn more calories, you're going to keep the fat off, you're going to stay motivated and be more productive, and ultimately be happier. Thank you so much.